SEQUOIA study is a randomized trial in patients with CLL or SLL who were previously untreated. And the study was a randomized study comparing Zanubrutinib as the investigational arm at the time and the bendamustine-rituximab combination as the control arm. And the study has already been, the initial reports of the study have been presented and published, and we knew that Zanubrutinib is associated with an improved progression-free survival compared to bendamustine-rituximab. So what we're showing in this updated long-term follow-up with 44 plus months of follow-up, we're seeing that, first of all, that difference in progression-free survival is maintained, and Zanubrutinib is continuing to have a better efficacy from the PFS standpoint. One of the new findings of the study is that in the prior report, we did report that patients with an unmutated IGHV had an improved PFS if they took Zanubrutinib compared to bendamustine-rituximab, but in the initial report, there was no difference in patients with a mutated IGHV, and these are patients who do well with chemotherapy. However, with the current updated report, we are seeing that even in patients with a mutated IGHV, we are seeing that Zanubrutinib is now statistically significantly better from the PFS standpoint. So also the SEQUOIA study included a cohort of patients with deletion in 17p area, and as we know, this is an unmet need, an important group of patients that we're focused on. So we are providing a long-term follow-up on these patients, and the progression-free survival remains to be very favorable in patients who received Zanubrutinib monotherapy with basically 4-year PFS of 79%. I should mention that Zanubrutinib treated patients without 17p had an 89% PFS at 4 years. So these are important numbers to remember when we discuss efficacy of these agents with our patients in clinic.